first of all, I have to say that today it's a co-joint episode with Karandeep Singh Badwal. And I hope I'm pronouncing your name correctly.
Perfect first time, Rodney.
Perfect. Who's you have the MedTech podcast, which is one of the podcasts that I actually listened to as well before I started my own. But for me, it was a journey that I took to get to this point. When I managed to get hold of you, and I was pretty excited, and I you're a nice guy. You gave me that intro call. We had an intro call and we spoke, and yeah, and then we decided to do an episode together, which is more like an open floor episode, really, where we're just discussing stuff. So yeah, so welcome.
Pleasure being on.
So yeah, so today we're gonna just be talking about well, firstly, like your background. I know you studied pharmaceutical sciences, as you said, and then you ended up in quality, and then so you ended up in sort of like regulatory affairs, and then you went from there to being a consultant in a sort of like quick way to say it, and it's quite impressive. So yeah, what would you say about yourself that I've missed? Because I'm sure there's a lot that you could say which I'm probably not able to cover entirely.
Yeah, definitely. And I think, like with many students who go to university, they're never 100% sure which direction they want to go to. They may have some idea which field or where they want to go, but they're never truly sure what they want to do with their lives. There's a small minority out there who say that this is what I want to do, and they go out there and they do it. And I say to them, God bless them. Perfect, you've got it. But majority of people are not 100% sure what they want to do. And for me, I was one of those guys. So when I was at university at my bachelor's degree, we were doing like some projects. We were pretending to do like MHRA recalls, and I was just like, this quality and regulatory stuff sounds quite interesting. Let's give this a go. And then when I finished my bachelor's, I was like, I don't know if I'm ready to hit the working world right yet. So then I went on to do a master's within pharmaceutical quality, and it sort of built that quality side of me. And again, just like many students, when you come out of university, you take the first job that's given to you. So it just so happened to be a medical devices OEM manufacturer called Owen Mumford, where I was actually working on the production line, physically building the components of the medical devices and doing physical quality checks.
Well,
And it just kind of trickled on from there effectively. And then from there on, I went to St. Jude Medical. And then St. Jude Medical ended up being bought out by Abbott Medical. And I was working with regulatory a specialist position. And then in around 2018, I decided to set up my own medical devices consultancy. And I did something that I really do not recommend other people do because it will take over your life, which is work full time and run a consultancy part time. Because I wasn't sure, some people go into consultancy, but I wanted to be 100% sure, is consultancy the path for me? Is this something that I really, really want to do? And that was my way to do it. And then when 2020 hit, the consultancy work was almost like 30 hours a week. And then I was doing full time 40 hours a week. And then, as you can imagine, it starts taking an impact on you. And then I said, you know what? Maybe I need to go full time into consultancy. And I decided to leave my full time job and then take it from there. So, yeah, the journey has definitely been ups and downs, but I don't regret it. I'm very happy to be in the position that I'm in today. Of course, there were regrets on the way. And then I was sometimes thinking to myself, do I really want to do this? But I'm very happy to be in the position that I'm in today and the way that it's worked out.
no, that's really good. I think it's quite inspiring. Well, for me, especially because it took like an unorthodox route, I would say. You will never get a textbook that will tell you to do exactly what you've done. And I think it has helped you to create this sort of like journey, which has made you quite a valuable person because now you got a podcast, and I realized you just recently released your episode 50. So I don't know if you're throwing some sort of like party for that, or opening a few bottles for your 50th episode, but I think it's something that's a milestone because I think getting that first step is quite hard. You know what I mean? But once you have that first episode out there, then it becomes easier. But before I even start talking about the podcast, I'm also going to just introduce myself as well, for your audience as well. So I and unlike most people, I was quite fortunate because when I was like 15 or 16, when I was in high school, I knew that I wanted to do biomedical engineering. But it was weird at the time because most people had never heard of biomedical engineering. They just thought like, what kind of a job is this, you know? So what I did was, because I was going to high school in South Africa at the time, I and the universities there weren't even offering the degree. So I knew it was time for me to sort of like, leave the nest and fly a long way away from home to come and sort of pursue this career that I wanted to do. So I decided to fly to England. I mean, I'd been in England on a scholarship here from an exchange year that I'd done here, which I mentioned earlier, which was sponsored by Richard Branson. And at the time, I didn't even know who he was until I got to England and I realized he's actually quite a popular person. So I mean, when I came back here for university, I went to university in Nottingham. I studied biomedical engineering. That's when I started it and this was around 2017. So I was quite happy. And after like 2 years in university, I was quite fortunate to get a placement here at Paxman, which is a company based in Huddersfield that make a medical device that prevents hair loss from chemotherapy. And was when I started working there, I sort of happened to work at the company at the right time. So I then started working in R&D. So all my career I've worked in R&D, but this one was quite special because I was now given the chance to work on a brand new medical device that we're in the process of inventing, but it was just a concept and nothing had actually been built at the point in time. So my job was to then design the operating system, which is basically the operating software for that medical device. And I worked on this for about a year. I was an intern, not doing intern work, and but my salary was an intern pay, which is still okay because it was, I was so grateful to be there, getting the opportunity to work on it. So that lasted about a year. Finished that, went back to university, and I graduated. And after graduated, I was lucky. I started working for J&J, Johnson and Johnson, but this time I was working on the MDR sort of like team, but also sort of like working on the MDR, which basically stands for Medical Device Regulation, which companies have been having to work through here. But I was doing that from a R&D point of view. So I would be looking at documents for design control there. So I did that for about a year and a half nearly. And then this year I recently moved to Recipharm, which is a Swedish pharmaceutical company. And I'm still working in R&D, but now I work with asthma inhalers and sort of like drug delivery devices. And that's when I decided to start MedTech 101 podcast in April. And I've been a bit like a machine, but I'll probably slow down a little bit as I get bigger, because I've been publishing nearly one episode per week on average, which consumes a lot of my life as well. So yeah. But then going to the podcast part, like what made you start yours? Because I think yours is you got a lot of following, like several thousand followers on LinkedIn and all over the place. And from what you told me earlier, the concerts you're not the concerts but the conferences you're attending, like you getting there, you widen your network and stuff like that, and you bring some really big guys as well on your podcast. So I wonder, what was the journey for you getting to that podcast in 2021 when you started?
Rodney, I'm pleasure you brought this up because no one's ever asked me this in a public domain. So this is the way. This is where I'm going to be providing the real answer. When I was at university, I always wanted to start a entrepreneurship or business podcast. But as a young student with my studies taking over, I never knew how to do it, and I never really had the time to invest in it. So then what happened was around 2021, I realized that I had quite a big network on LinkedIn full of interesting people that I would meet at conferences or speak to offline. And they had really interesting stories that could benefit other people, that people could learn
Nice.
from, but they were not doing it in a public domain. So one day I just decided to, I'm just going to start a podcast. Let's see what happens. If maybe it's just a few episodes. If it doesn't work out, fine. I can always shut it down, right? Because I realized there was so many interesting people in my network. And then here we are, Rodney, as you've just mentioned. I've just released episode 50 today, so it's worked out really well. And for me, it's a great way for me to learn what's happening in the industry because regardless of what you're interested in, what would take you many hours of Googling, if you had an expert in front of you, you can probably learn in 30 minutes. And that's exactly what I do with the podcast. I ask them the questions. And the pleasure that I have with the podcast is on the public domain, so other people can benefit from that person's knowledge. And then, of course, it's also the networking. I get to meet people that I otherwise would never meet through my everyday work or my everyday life. So it's just a great way to meet other people that I otherwise would never meet. So, yeah, that's the real reason why I started the podcast. And for me, it's a hobby. And then, as you know, Rodney, you probably don't make money from this. I don't make money from the podcast, but
Of course.
the knowledge we gain from it is the true value of it. That's the knowledge that we gain and what we can share with other people is what makes it valuable.
True. No, I'm really happy to hear that. I've always thought I've always thought your business acumen is quite high. Because most people would just see it as, as an extra job they have to do. I mean, both of us studied STEM subjects, and by STEM subjects, I'm talking about science, technology, engineering, maths subjects. So they don't teach anything about media communication there. So I guess for you as well, you've had to learn each thing bit by bit as you've been working on this journey. And is that been comfortable for you or not? Or I wonder how it's been for you, because for me, it's been a steep learning curve that I've had to do. But I don't know, how have you found that, sort of like working in media, but you got a science background?
It's quite interesting. So many people don't realize this. My father was very much into computers from a young age. So my father is a mechanic and he owns his own garage and he's always tinkering with cars. And I remember from a young age that he was always buying computers and putting these components in. And I was like, Dad, what is this that you put? And he'd be teaching me little things about technology. And he's like, look, whatever it is, make sure you tinker with it, make sure it's pin perfect. So from a young age, I've always had this thing that whatever you have in front of you in terms of technology, don't be afraid to go inside and explore what it actually is. How does it work? What are the components? And then that's always been integral to my life that no matter what I do, I always want to know the ins and outs of it, whether that's something like gardening, why does a plant grow this certain way? How do you make this plant grow? What are the nutrients that you put into it? It's always questions that I've always asked. So, yes, it was something that I embarked on, but I very much enjoyed it. I knew nothing about media, but then I asked myself every single question. How do I make sound better? What is the software that I can use? What makes a great podcast? And then for me, it was just like discovering something new. And it's almost like a child when a child is exposed to like a new hobby or a new sport. You just want to know everything about it. Like if you get a child and you put them into football, like, okay, how do we score in football? What are the rules? And what do the different team players do? So me, it was hard, but it was also something very enjoyable and something that I
Nice.
got to learn basically.
No, I'm really happy to hear that. For me, I think it was more of a thing of like, because I like medical devices, but I felt like I wasn't covering the whole scope of all the medical devices. So I was trying to learn about as many medical devices as I possibly could. And over my time at university during those 4 years, I learned quite a lot, but I still felt that there was more out there. So out of this curiosity, I just started reading a lot, about things that are happening, whether it's an economics book or something, and sort of try to make it relevant to medical technology. So the way I run my podcast is a little bit different, because there's some episodes I do by myself, because what I do is all the information I get from the books I'm reading, and stuff, I tend to write an essay. Well, I started writing essays now, because before that it would be something that I would just go to my friends and share with them. But I realized, why can't I do this for a bigger audience? So what I do now, if I've got a topic which I really want to discuss, with my eyes from what I'm seeing on the inside of the industry, trying to also inform other people out there. First of all, I try to remove all the jargon. I try to use basic words, just so that even a 5-year old could understand. And then I write the essay, and then I turn that into a script. So so I did this for the first like 6 episodes. And afterwards I was like, okay, let me see if I can reach out to other people to try to get them onto the a podcast, because at that point I felt like I didn't really know a lot of people. So I wanted to create a podcast running by myself to sort of like prove the concept to them. But then I realized there's some areas, even if I read, I would not know entirely. So for those kind of things, I try to bring them on. So that was the journey for me, sort of like starting the podcast. So um then I for me it was a huge step, because I said, I work in R&D, like most R&D engineers. you're in the back office. It's not a client facing job. So in most cases, you don't have to talk to anyone besides the guy who you sit next to, like, 9 to 5 every single day. So this was also something that was like a new step for me. I mean, I've always enjoyed, like public speaking if I get the opportunity, but in R&D, you're not gonna get many of those. So, hence this was also an opportunity for me to grow as well. So I like the fact that you say that it also opens a network, like a networking factor to it. And for, as we both discussed, that we don't make money out of this. I think at some point we all wish we had a $200 million contracts with Spotify, like Joe Rogan, but we have to work our way there. Or but for now it's mostly run out of the love of it. And it's really interesting, the people you tend to meet, the people you end up meeting. And one thing I really loved is that, these people who you meet sometimes end up teaching you something that's really valuable, like from the conversation we had last time. I learned so much there, and I just want to take this opportunity to say it right here, because like when we discussed and you told me, like, like about, the your mindset, how you see the world and stuff like that. I felt inspired afterwards. I was like, you know what, Karen told me this. I need to level up. I need to level up on something. I need to work on something. So yeah, so I guess, and that's one thing I like, and that's the reason why MedTech 101 exists today. So yes, it's not 100% perfect, but it's gotten a lot better. Well, because there's some episodes I don't release, and I feel like, okay, that wasn't good, and I keep it to myself. But there's also other episodes now which I release, and the feedback has been quite nice. There's some people who've reached out on LinkedIn, connect with me. People have said they want to get on the pod, and there's been cases where I didn't even have enough equipment. I was like, I had people who said they wanted to get on the podcast, and I didn't even have two microphones. So I had to, quickly dash and, grab a second microphone, get a mixer, learn how to use it, so I can start accommodating these people. So that has also expanded my audience. And out of curiosity, do you do any in person interviews? Out of the 50 you've done, have any been in person?
Not on my own platform. I have been on other podcasts, webinars, conferences, which have been recorded live, whether that be a panel session, etc. But I've
Nice.
not done it with my own personal podcast at this moment in time. I wouldn't rule it out. It may happen in the future, and you
Yes,
may be one of those people. So
of course.
let's work this out.
Definitely. I think the in person ones, I did one, and that was the first. Well, that was the second interview that I had done, and I found the in-person ones to be, how do I say, to have a bit more, um, well, technical difficulty that comes with it, because not only do you have to set the microphone and make sure that everything is okay, if you're gonna bring that with the camera, you need to set up the cameras in such a way that you're having these angle shots and stuff. And yeah, so hopefully that's something that's going to be coming from your podcast, because and every time you release an episode, I'm always looking which guest is this, and I'm sure you got a lot of guests lined up for people to hear. So yeah, if guys, if you want to hear good podcasts, like, go check out Karen's podcast, Karandeep Singh. Because there's two podcasts called the MedTech podcast. I don't know if you noticed, Karen. So
Yeah, there's another guy
yeah,
called Ash Tatler based in London. He's actually
yes,
reached out to me, and then we are planning on doing an episode sometime soon in the future.
yes. So I realized there's like two names. I'm like, but Karen's one's got a purple sort of like a header or logo.
It's got my face on there, so that's how you
Exactly.
spot it.
That's everything you need to know. And Ash, and I also listened to one episode from Ash, because I think he's studying medicine in Nottingham. So I've listened to one of his episodes as well. So he seems like a really nice, chilled guy as well. So that'll be nice. I'll be looking forward to that as well. But then, other than this, I also wanted to take this chance, to ask you a question, because I know, like, as a consultant, and a man of many jobs, consultant, like I would also say a podcaster, and from what I hear, you're also quite good with your hands in terms of getting cars to perform the way you want them to. So you're a man of many talents. But I wanted to give you this chance to also then just describe what's been happening right now in MDR, because I understand that's your focus right now in terms of helping American companies get an understanding into European markets. Or
Yeah, effectively. So how it used to work in the past is that medical device companies will come to Europe, do their innovation here, and then go to US afterwards. What's happened now with the EU MDR is the backlogs. That's due to lack of notified bodies, lack of resources, etc., where companies are now thinking, you know what, we want to go US first and then come to the EU. So the dynamic has flipped. Now, recently, what's come out is due to this situation, there has been an extension that has come in. So for companies that are currently MDD certified, there is an extension in place that allows them to keep that certificate until 31st of December 2027 or 2028, depending on the classification of the device. Now, for them to be eligible for that, by the 26th of May 2024, the manufacturer needs to have in place a quality management system in accordance to Article 10.9 of the EU MDR and must have lodged a formal application with a notified body. Then by 26th of September 2024, they must have had a signed written agreement with that particular notified body in place, and then they can go for that deadline. Sadly, what's
nice.
happened with companies, they just go, oh, we don't have to have MDR till 2027. Boop, we're going to sit back and relax. But they don't realize there's work involved in that. And then anyone who's like myself or yourself who works in medical devices, trying to get a hold of a notified body is an art in itself. It takes so long. And like today is the 28th of June, 2023. My
Yes.
argument would be if you haven't got a notified body, start today. Because that's the only way you're going to get it in time by 26th of May 2024, guaranteed. So it's
Yes.
not really an extension. It's just a bit of breathing room saying, hey, look, we understand you couldn't get a notified body in time. We're going to let you have a little bit of breathing room, but get your stuff in order. That's basically what this means.
Well, and because when I was working at J&J, working on the MDR uh, team and stuff, we had the pressure to try get it done by May of this year. So in theory, MDR should have been complete. But I understand a lot of companies were behind it. Most people were worried that they'll not be able to sell their products. And, some of them were even thinking of either just picking up the whole factory and company and putting it into Europe so they can try to avoid some of the additional regulations or regulatory affairs requirements they had to meet. So the extension, I think, has come as well as a bit of relief on most of these guys. But I think it's nice what you say, that it's important that they still have to understand that there's deadlines that are next year that they have to meet for them to have, that sort of like deadline in 2027 as they think. Because I won't lie to you, when I saw that, I was like, okay, cool, nice. I was also like them, oh, another 3 years, another 4 years, this is good. But I guess it's really important that you say that. And but why do you think as well that it takes so long? Is it because these notified bodies are swamped with work, or what exactly is happening? Because from my understanding, the guys at the BSI, which is the British Standards Institute, which is a notified body, one of the notified bodies in England, the salaries are pretty good there. So what exactly is happening in the background? What's making them take so long?
So if you work at a notified body, you need to have technical expertise in the particular device that you're working with. Now, if it's something like a pacemaker, defibrillator, these things have been around for decades, possibly hundreds of years. So there's plenty of people that can do something like that. So the backlog is also affected by the types of devices that you're working with. Now, if you look at the concept of software medical device, it's a very small minority that have experience in that field. So number one, it depends on the type of device that you have. Number two, of course, is that what's happened is the amount of notified bodies has dropped. So under the old MDD, I don't remember the exact number, there were multiple notified bodies who said, you know what, this EU MDR stuff is too much for us, we want to drop out of it. And one good example of that was LRQA. Sorry if I pronounced it correctly, I think it was, yeah, Lloyd's Register effectively, who
Yeah.
dropped out. So what's happened is there are now less notified bodies and more medical devices, which has of course caused a bottleneck. And then, of course, generally with notified bodies is if there is somebody who's a technical assessor, they generally are required to have 2 years experience within that particular field. So yes, people are being trained, people are bringing in. It's just a combination of a lot of medical devices and not enough expertise within notified bodies to be able to assess for them. Now, what notified bodies are actually doing to get around that is they're hiring contractors and consultants like myself to help bridge that gap. But again,
Nice.
the demand is so high, there's only so much that they can do. Now, over time, of course, that demand will sort of fizzle out and it will smooth out. But for now, there's far more demand than there is actually supply
Yes.
in terms of notified bodies.
True. Because also one thing I've noticed, one thing you mentioned right now, in addition to that demand, one key point you say that really kind of interested me was, for someone to work in the sort of regulatory roles, they have to have the technical expertise. And we have new technology coming through for MedTech, like the nanotech, in terms of the applications of nanomedicine, which is new right now. People are pushing for this sort of like AI getting into medtech, which is something also that's going to take long. So it's like essentially you're saying that for someone to be able to police this technology, they have to understand it, which makes sense because in some cases they don't. And I think that's what makes it take longer because they have to wait for someone with the expertise, and they have to work around that person. So yeah, it's for me, I always see it as a good thing. It's a good problem to have, because on the other hand, you could have no development going at all, and then we all have bad devices or old devices on the market. But this, in this case, it also shows the rapid development that's happening in medtech, which is something that I really like because obviously I'm an engineer, so I'll have a bias. But yeah, so no, that's good. And just out of curiosity, for those companies that are sort of like stuck in like somewhere in the middle, their MDA process is not quite there yet, and they don't really know if they're gonna make it or not. Is there anything you could say to those guys who find themselves in that position?
Start talking to the notified bodies immediately because what I'm finding with a lot of these companies go, no, we want to get our technical files in order. I'm like, guys, it's probably going to take you up to a year just to get the audit date right. So you need to start the conversation today. And there's nothing wrong with saying
Yeah,
for a notified body, hey, our tech files are not going to be in order 6 months, 9 months from now. Get that contract in place and then you can make benefit of that extension that's coming. So that's number one, of course, start the conversation today with notified bodies.
yes,
Number two, hire the correct expertise, whether that's consultants or a permanent person in your company. You want to do it first time right. There's no point just throwing a technical file and just hoping that it goes through and then you're going through rounds and it potentially may get rejected. Try to do it first time right and put the adequate resources on there as well. Number three, of course, is you can explore other markets. So a lot of people saying, oh yeah, go US first. Okay, great. You may go faster on the US market. But look at it from a health economics perspective. The demands in the US market are completely different. The healthcare system is different. The reimbursement is different. They run an insurance-based system, whereas in UK and Europe, it's more of a state-based system. So generally, faster is not always better. So that's
makes
what
sense.
companies need to consider.
I think you can even say that again because for and one of the reasons we said the reason why things are expensive in the US sometimes compared to the UK is potentially due to the number of middlemen between the manufacturer of the device and the patient, which then also then increases the price because everyone will be taking a certain cut for themselves, which is as you'd expect. So yeah, I guess that's the question I had for you today, just to showcase your knowledge as well to my audience, because I think it's very valuable things that you say. But I'll give you the chance as well now to also ask me some questions.
Rodney, you amaze me how much you've traveled the world. You've been to South Africa. You've even been to my homeland of Punjab in India, and you went to the Golden Temple in Amritsar, which isn't very far from where my ancestors are from. And now you're living in the UK. How do you travel? How I know it's work related, but how have you been able to travel so much around the world, and what challenges have you faced?
Well, to start off, I think well, sometimes I always like to make this joke with people that sometimes you don't choose a certain life kind of chooses you. Because for me, even the way I started going to school, I was born in Zimbabwe, lived there until I was 10, and I started going to school in South Africa. And the way I went to school in South Africa was actually by accident. It wasn't planned. I was supposed to have just gone to South Africa for a summer holiday and then get back to Zimbabwe and study. But I went for one summer holiday and I ended up, just getting enrolled in the local school, because at the time there was like strikes happening in Zimbabwe and riots and stuff. So, because of this, I think a part of me has always been always kind of like open minded. I've always wanted to explore different cultures and stuff. So, whenever I got the opportunity to go anywhere, I would say yes. So, when and the story of how I went to India was in university. They have this what they call like summer scholarships. Like in the summer, maybe you can go to a certain country for a few weeks or a month, or some people even go for a year, and you just learn there, and then you get back, you continue your studies. So for me, it was the Easter holiday of 2018, and like this opportunity came up, and I applied, and I wasn't even worried. I was just like, let me go. And we went to Chandigarh as well. We spent most of the time in Chandigarh because I went to the University of Punjab for about 3 weeks, and it was it was amazing. It was something new. So a part of me has always have had this attitude to say, you know what, I'm gonna live my life in the present, because when I used to speak to some of my friends in university, are you planning to do any trips, or should we go somewhere? They'll be like, nah, I'll do it later after I finish university. But we know what happened when we finished university. COVID happened. My age group is one of the people that graduated in the middle of the pandemic, and there were no jobs to be found. Most people had to move back home with their parents. So, but prior to that, prior to COVID, I got into a point where I was averaging about 10 countries per year. Because when I was in university, when I saw that I didn't have a lecture on Monday and Friday, I saw that as a potential trip. Literally, that's how I was thinking. I was like, okay, you know what? I need a visa for most of these countries. So to be able to do like, I think roughly I've done nearly 33 or 34 countries, I have to count, with the Zimbabwean passport, which means I need to get a visa every single time I go somewhere, which is annoying, but I try to maximize that. So I guess that's been my approach really to life, to just try to live in the moment. When you have the opportunity to do something, you do it right there. And most of the traveling I've done actually has not been because of work. The only work trip I've done was a trip from Huddersfield to Coventry. That's the only work trip I've done, because in R&D you're not gonna get work trips. It's not a sales job. You're stuck in the office, in the labs, wherever, just focusing on building that device. So then I make it up to myself that when there's a long weekend, what trip can I do there? Can I do a city break in Paris? And you'd be surprised how cheap it is, especially in Europe, to plan these things. But then outside of that, I've also been quite lucky because I've also traveled quite a fair amount with the Boy Scouts, because I joined Scouts when I was like 10, doing the camps and, selling cookies, fundraising, all that kind of stuff, which I really love. I love outdoor stuff. And actually, in 3 weeks' time, I'm going to be at the World Scout Jamboree in Korea. So I'm going to Korea for like 3 weeks, just, going to be camping. And just to clarify, it's South Korea, not North Korea, because everyone keeps asking me, is it South or North? Maybe I should start saying it's the North, but I know that joke won't age well. So yeah, but yes, it's also that opportunity to just joining clubs, doing things that make you meet people. Because even right now with this podcast, there's some people who want to do it in person. So now I have to start thinking, okay, I'm gonna have to go to their offices or somewhere. But it means that you start seeing new parts of the country which otherwise you wouldn't have gone to. So I'll just say to anyone who's watching this right now and they're thinking, oh no, it's too expensive and whatever. I would say for Europe, you can literally do Europe without spending a lot. If you just plan it well, you got low cost airlines, 3-star hotels in Europe are fine. Maybe 3-star hotels in some continents I wouldn't trust, but in Europe you'll be okay. So but essentially you need a place that's clean, where you leave your bags, where it's safe. So I wouldn't say no, go stay in hostels, because that's not what I've done. But yeah, so get out there, meet more people, join a club, start something that, pushes you out of your comfort zone. Because it's easy to say you want to stay in this small town or big city you're used to and not explore other destinations. But one thing I like about traveling is that every time I go to a different country, it's a different language. I don't speak it at all. I the only European language I speak is English. So, but I have to navigate that new terrain. You have to. It's like it activates some sort of like new genetics in you. So you discover something about yourself. You're like, okay, you can deal with different cultures, different changes pretty well. So that's what I would say, and that's how it has happened, really, in terms of to give you a full, explained, detailed answer as to how I've traveled and why I can't stop now.
No, definitely, I agree with you. It's kind of just go there and do it.
Yeah.
Stop sitting there, stop planning, stop thinking. Just sometimes you just have to get up off your chair and just go and do it, take the risk, and then somehow it works out.
Yeah, and I would say it's even super easy before you have, a lot of responsibilities and stuff. But again, even when you have those responsibilities in your life, in this country, I think every worker is entitled to about 25 days off per year. And I know some people still can't finish all of those days. They can't choose all of those days. Most people don't even explore, the UK alone, or whatever country they're in alone. Because even if you just focused on trying to maximize the country you're in, you'd be surprised. I was literally surprised a few weeks ago, because right now I live close to Cambridge in Norfolk. I drove to one beach here on the Norfolk coast, and I was surprised. I was like, "This is so beautiful." I felt like I was in a different country, and I was like, and I've never seen this on any blog or anything. So sometimes you find those hidden gems really close to you without having to travel really far away. So I guess it's just having that attitude of saying, you know what, you want to see more places, you want to go and explore more cultures and meet more people, and yeah, it definitely makes you grow in a particular way.
Yeah, I completely agree with that. Every time I've travelled, I've always come back richer, and I don't mean richer in terms of finances. I mean in terms of knowledge
Yes.
and what I've learned about the world. And then you quickly learn that all humans are the same. We all
Yes.
have similar problems and things, and the differences between us are so little. And you realize that when you travel.
Yeah, and one more thing, really. I know you mentioned that you hadn't taken a holiday for about 10 years, sort of like working and just not doing things that you're doing. Like, how did you feel when you took that holiday last year in December to Jamaica, which is, quite sunny in the middle of the winter? How was that for you? You know?
It did feel strange, of course, that I
Yes.
didn't have my laptop with me. I had my phone with me, so I was checking emails. But I did go late December, so it was around the Christmas period when work's a little bit more quiet and things. But it was just nice to just focus on what's in front of me because when you're an entrepreneur, you run a business or you're a consultant, you're constantly thinking about work. It was one of very few opportunities that I had. I could just focus on what was in front of me. I could just explore the beauty of Jamaica, the people, the food, and things like that. It
Yeah.
was just nice to just go into that. And I'm glad I took that trip because when you go and visit a different culture, you learn lessons about life and you can come back and you can bring that. And the one thing you know about the Jamaican people is they're not necessarily the most prosperous or the richest. But one thing you quickly realize when you walk around the company, everyone had a smile on their face.
Nice.
That's one thing you realize. They could be really, really poor, but they had a smile on their face and they always found a way to enjoy themselves. And that's one thing that you quickly learn about Jamaican people that whatever they have, they make do with what they have. So it just makes you realize, that they've got far less resources than we probably have in the Western world, but somehow they're
Yes.
happier than us. So they're doing something right.
True, true, and nah, that's really good. And I think it also reminds me of just like how I was growing up. Because in Zimbabwe sometimes was with the scouts and stuff. I got to go to different places in the country, and we used to just play games like in the mud and stuff like that. Not to say that we don't have anything else there, but it's just people aren't as driven on work. One of my mates came to visit me this weekend, and he was asking me like, "Is the work more stringent in Zimbabwe or in the UK?" And I told him, first of all, I'm grateful, to be here. The reason why I'm here is for my career, because obviously I left my family behind and everything like that to try and, and get my career going, which I've been quite fortunate that it's been working out. Okay. And, but the thing is, in these countries, like on the weekends, for instance, in Zimbabwe, if you took some money to the bank on a Friday afternoon and you want to do a bank transfer, they'll tell you, yeah, it's fine, we can take your papers, but when they're gonna submit this on Monday, because on the weekend the whole country slows down. So you find that in these countries where maybe people aren't as driven in terms of trying to get the maximum profits possible, which I probably blame for why we're developing a lot slower. But it also means that people have also been able to then invest some time into, their families, their health, because on weekends in South Africa, when I was growing up in South Africa, you knew every weekend there would be like a barbecue somewhere. So, like, and us, we used to call it a braai in South Africa. We call them braais. We don't call them barbecues. It's the breed stew. So this also then just showed the different sort of like, what life means, for people in different places. Whereas here people still take summer off, there's still festivals and everything, but we have more bills to pay here. You got council tax, you got you know all this kind of insurances you have to pay for and stuff. And but the opportunities are great to hear. So I'm also grateful for that opportunity, to be able to work on something and be able to contribute essentially to other people's lives. So and yeah, so just looking at the time and everything, I was just also gonna take this opportunity to ask you, like, since you do a lot of things, like, what motivates you? Just like an odd question, like, what motivates you? What keeps you going? Because I don't know how many hours per week you're working, but I know it's not 40 hours a week. So, what's your why, and how do you feel satisfied?
My grandfather came to this country as a first generation immigrant. He would work 12-hour shifts 7 days a week, and he would have to share a bed with somebody just to pay his rent. So one guy would do the day shift and one guy would do the night shift. And somehow, within 15 years, he owned a property and he was living good, and he managed to retire by the age of 60. What excuse do I have that a guy can come here, not know the language, do this and just work so hard? And I have so many opportunities around me to build this. But it's not just that. Even with like the podcast and the videos, I enjoy helping other people. It's like a form of charity to me. When people think of
Yes.
charity, they just think that, oh, I donate X amount. But charity is in many different forms. It could be just me phoning a friend who's feeling depressed and making them feel better. It could just be speaking to somebody on the street. Charity is in many different forms. And I think that's what humanity is well. If you're doing something that's making the world a better place, that in itself is a deeper sense of satisfaction than just go out and making X amount of money. So that's really what keeps me motivated is the medtech industry is helping other human beings. I'm playing a part putting medical devices out there that are helping people live longer, helping people live with certain conditions, and that is putting a smile on other people's faces. They then project that smile on the rest of the world, and then more people are smiling and a more positive world, and it just makes the place a better place. Well, better place to be, basically.
No, that's really good, and that's deep. I guess the it's like that feeling of giving and the reward feeling that you get. But do you get sometimes like a feeling that because you enjoy what you do, sometimes you just want to lay down, but you have to record that episode because you feel like now you actually owe your audience content. Do you ever have that feeling, like you feel like your work is so meaningful to other people, you feel like you have to give them this content consistently? I don't know, how do you feel about that?
Yeah, very much so. It does happen. So you do sometimes feel guilty, and
Yes.
I've had messages from people on LinkedIn saying, "Currently, what's wrong? You haven't made a video in a while." I'm like, "Okay, well, I need to do something." But the way that I do it now is I build systems where I have particular gaps or times of day which is just content focused or just podcast focused. And then what I try to do, Rodney, you probably do this yourself. You try to record so much content so you're covered for a few weeks. So even if something comes up in your life or your work where then maybe, for 2 or 3 weeks you can't dedicate any time to that, you've got content in place. And I think that's what people need to do is make sure there's always a bank of content that's always there ready for you. So if anything happens in your life where maybe you can't commit the time, you can always go back to that bank effectively and then put it out there. So yeah, it does happen from time to time, but then I enjoy what I do. I don't really care that, sometimes I have to sacrifice things, but you have to draw the lines at times. If there's a family birthday, I'm there. If there's a family wedding, I'm there. You
Yes.
have to be there,
Yes.
especially in Rodney in our cultures. If somebody invites you to a wedding, you better be there. You need to jump on a flight. You need to sacrifice your sleep. You have to be there. But
Yes.
then
And
you work around it.
definitely, I agree with you. I agree with you. And talking about family and everything, like how your grandfather came to this country and what he managed to do for himself. and being there for these wedding events and all these family functions, and at the same time being able to still get the content out there because it brings a lot of value to people. Balancing all this, it kind of starts to make you feel more uh, good in a way. You feel like you're trying to get to the level of I don't know, like self actualization, because if you're working to improve yourself, and you're trying to also improve other people's lives. And and from my side, I've been quite well, the reason why what motivates me is obviously because I like medtech, but the reason why I really like medtech is because having growing up and seeing the gaps, the medical devices people didn't have, and thinking that what should I do to sort of like bridge this gap of medical devices between developed nations and so-called undeveloped nations, is what kind of drove me into R&D, because I realized, by pushing the technology forward, right, we essentially making it more accessible to people, in remote places where otherwise the technology wouldn't have been there. But then getting that a bit of information and sort of like, educating people and letting them know about what's out there, what's happening, linked to this sort of like passion that I have, kind of really excites me. And I have to say, sometimes I'm upset because I miss the odd family function, because I'm literally in the UK by myself without my family here. And so when I get to go home once a year, I try to make sure that I go home when there's the most events happening. But if something happened, if like in a emergency, or like a wedding or something happened, I'll try to be on the flight the next day to go home. So um I definitely see your point. And yeah, I'm just really grateful, for just, having this conversation with you today. And I'm sure a lot of people are going to enjoy this conversation. So yeah, so that's about everything that I had to say. And I don't know if you had something more to discuss, Karen.
Whatever it is you have in your mind and you're thinking about doing it, go out there and do it, because the worst that can happen is you failed and you live a life without regret. If you are on your deathbed and you had these ideas and you didn't execute on them, you're always going to think, what could have happened if I tried it? Whereas if you failed, you can live with the satisfaction that you did. So for the listeners today, if there's something on your mind, go out there and try it. And if it doesn't work out, fine.
Exactly. There's some words of wisdom, and that makes sense, right? There's nothing to lose, and you should just try, because at least even if you try, you don't have to regret. You don't have to say, "Oh, I didn't try." You can always say, "Yeah, I tried and it didn't work out, and maybe something else will work out for me." So yeah. So thank you very much, and this episode will be like obviously to be available on MedTech 101, but it'll also probably be available on Karen's channel as well. So yeah, since it's a co-hosted episode, even though I asked you a lot of questions, I really enjoyed it. I learned a lot today, and I hope you guys learned the same as well. So yeah, thank you. And please subscribe to Karen Depp's podcast. It's really good guest there. So yeah, thank you.
Thank you very much for your time, Rodney.